And then let's look at water. The younger the child is, the greater percent of their body weight that is water. Um, so in terms of infant water, that water is moving between cells and in vascular space. Um, there's a greater amount of that water in between the cells. So it is easier for infants to lose water than it is than it is for adults because as adults we don't have as much free water floating between cells and in vascular space. So if a child is in a very hot and humid climate and they're sweating, if they are having losses like from diarrhea or vomiting, then we may need to add some sort of extra water or an electrolyte solution like Pedialyte for babies. But this is definitely should not be considered the norm. This should just be in those particular instances. So we talked about breast milk, and you know how you all know how I feel about breast milk, that it's just a lovely food and perfectly made, with the exception of vitamin D for these babies. It should be the complete nutrient source for the first 6 months of baby's life. And you'll see recommendations about 4 to 6 months. We'll note that the American Academy of Pediatrics, they recommend exclusive breastfeeding for the first 6 months of life. And this is recommended because it's more easily digested than formula. Babies are going to do, like we said, about 8 to 12 feedings per day, and we want babies to eat on demand. So when they're hungry, they'll get fed. Again, they are the best, most intuitive eaters on the planet. They eat when they're hungry and they stop when they're full. We could learn a lot from babies. Um, we talked in the lactation lecture about the carbohydrate being lactose and the galactose and the glucose, how they're combined via the blood um, to make the disaccharide lactose. We talked about the benefits of the oligosaccharides in breast milk, which is preventing pathogens from binding in intestinal cells, promoting GI health. We looked at these nutrient percentages for breast milk compared to adult diets. And I'm going to skip these slides because these are a repeat from the lactation lecture. Okay, so then we get to infant formula. Okay, infant formula composition is meant to be as close to breast milk as possible, but it's not exactly the same. There are very strict, as you can imagine, infant formula standards in the United States. They're based on American Academy of Pediatric recommendations and very stringent quality control procedures. Majority of our standard infant formulas, it might be that the names that you might recognize would be something like Similac or Infamil. The carbohydrate is typically lactose. The protein is typically non-fat milk and whey protein um, in a standard formula. Okay. If a child has some colic or some fussiness or some GI distress, they might require some specialized formulas. And those would be formulas made specifically with soy protein. So it's cornstarch and sucrose, not lactose. This could be used for a vegan family if they would choose to. And then if a child has a soy and a cow's milk allergy, they might be put on a hydrolyzed protein formula, which might be something like Alimentum or Nutramigen. And that would be a specialty formula, very costly, and oftentimes requires a prescription from doctor if they're getting WIC benefits or some assistance with the infant formula. All of these formulas can be delivered safely to baby, and we'll talk about ways that mom and dad and caregiver